When hospital staff fail to speak out against poor care, the challenge falls on relatives. Julie Bailey watched Panorama's undercover nurse with no clue that one day she would take on her local hospital.
I thought it was a one-off. You know, that's something that's happening in another part of the country. That doesn't happen where we are. That wouldn't affect me.
But it did. In Stafford.
It happened to me. It happened to the hospital that I took my mum to.
Julie Bailey's mother, Bella, aged 86, had been taken to Stafford General Hospital in September 2007.
I put my trust in people, but from the very first minute that I was in there, I thought something's wrong here. And a lot of the patients that were on Mum's ward, they couldn't speak for themselves. So the relatives were visiting them, oblivious to what the deprivations before they got there.
They were so worried that for 8 weeks, family members maintained a 24-hour watch at Bella's bedside, keeping a record of what they saw.
Buzzers left out of reach for patients to use, patients not being helped to wash, or those needing total care not washed at all. Elderly patients left in chairs all day from 7 o'clock in the morning till late at night.
Failures in basic nursing care, and an anxious family who also felt the fear of being branded troublemakers.
And one thing I said to the family is that under no circumstances do we upset a nurse or a doctor. You know, we just take what they say and we look after Nan because they can ask us to go, and then we've lost everything.
Bella Bailey died in the hospital in November 2007. Julie was determined to make people aware of what she had seen, but struggled to make her voice heard.
First I spoke to the newspaper, the local newspaper. Then I went to the MP and spoke to him. Then I went to the Health Scrutiny Committee, spoke to them. Then I went to the Board of the Governors and I spoke to those. I spoke to the Primary Care Trust. I spoke to other MPs in the area. I just tried to tell as many people as possible.
She set up a campaign from her cafe, unaware that the then government regulator, the Healthcare Commission, was preparing to investigate high death rates at the hospital between 2005 and 2008. The report agreed there were serious concerns about patient care. However, nobody had spoken out publicly. But it seems some doctors were privately aware of the problems. The Commission's report stated that of the doctors interviewed for their investigation, a majority said they would not have been happy for a relative to be treated there.
It isn't good enough for their relatives, but it was good enough for ours. You know, if we'd have known what was going on in that hospital, if they'd have spoke out about what was going on in that hospital, none of us would have put our relatives in there. We would never have put our trust in those people.
And this local Staffordshire MP had more reason than most to be shocked.
Nurses cannot have been happy working in that situation. Doctors must have been appalled at the fact they could not deliver a proper level of care. Why were they not jumping up and down?
Good question, because 10 years ago he'd helped introduce legislation to encourage employees to speak up. The Public Interest Disclosure Act was intended to give whistleblowers legal protection from dismissal or victimization.
The whole point of introducing whistleblower provisions was that someone had got somewhere to go so they could raise these concerns quite properly without threatening their job, without damaging their career, and indeed without having to go to the media.
But in Staffordshire, there was a whole culture that discouraged complaint. The investigation noted that nurses
felt poorly supported as a profession,
consultants
appeared to have given up expressing their views, since managers were said to dislike critical comments and ignore them.
The government should revisit what it said to health organisations in the past, and they've said good things about the need to get whistleblowing procedures in place. But we know from the Stafford case, and I suspect from other cases too, that what is said in terms of guidance and what happens on the ground is probably very, very different.
The new leadership of Mid Staffordshire NHS Foundation Trust told Panorama that quality of care is now its primary concern. It is investing £12 million in extra frontline clinical staff, improved training and facilities, and has published a new no-blame whistleblowing policy that aims to bring poor practice out in the open.